Hello, this is Keeping Up with Ken. I am here today to talk to you men, probably, maybe some wives, about a very serious subject of prostate cancer. I know when I was diagnosed with prostate cancer, I was looking on YouTube and Facebook and every place where I could find real people that were going through the same thing that I was going through. I just didn't want to hear it from doctors. I wanted to hear it from actual patients. So that's what I'm here to do. I am a real patient that had prostate cancer and maybe still have it. We all know there's no guarantees, but I want to at least walk you through a little bit of my experience, because if you're recently diagnosed, I know you're looking, and instead of just being told by the doctor or the urologist, you're probably going to be like me. You want to find other people that went through a similar diagnosis. So, anyways, I was diagnosed in 2025, early 2025. It's currently the end of July of 2026. So I'm still alive and I'm still here. Hoorah. But anyways, I my PSA over the years was rising, so I was getting checked every 6 months. And what happened to me, I had a doubling of the PSA. It's natural for men as they grow older. I'm currently 66, so mid 60s, that your PSA is going to go up, even if you don't have cancer, because your prostate, generally as men age, our prostate gets bigger, and that's why they have to have all the, nighttime bathroom trips and what have you. But anyways, my PSA was going up, and it was usually staying in the fives and the six range, not drastically going up. So for a 6-year-old, that could be somewhat considered normal without prostate cancer. But then I had a doubling of the PSA, and generally within 6 months. And generally, that's a big alert that there's something going on more than just a large prostate. So after I was notified that I had a doubling, they said that the urologist contacted me, and the only way they can definitely say it's cancer is by doing a biopsy. So of course I went into panic mode and started doing a bunch of research, and I saw that normally they do MRIs before they do biopsies. So I called and talked to the nurse, and I got them to agree to give me a MRI with and without contrast to begin. So remember, anything I'm telling you is not medical advice. I'm just giving you what my experience was so far in this prostate journey, which all sucks, by the way. But anyways, they agreed to let me have an MRI first. So I went and had the MRI. The results of that was that there was a problem area on my right side, and they can't say for sure the problem area is cancer. There's no way of them knowing by looking at an MRI. They can just see there's a problem area. So the next thing they wanted to do was a biopsy. So I more or less had to agree with that. And I was paying for extra PSA tests throughout these weeks of discovery. And my PSA actually dropped after doubling. It dropped almost back down to normal. It dropped down to like 7.8 from like 11.7. So it dropped way down. I thought, if it's cancer, wouldn't it keep on going up? Why would it drop down? So that was giving me hope that it wasn't cancer. But, and then I kept on having it rechecked, and it went up to 8.1. And at that point, I'm like, I might as well get the biopsy. I gave in to the pressure to get the biopsy. So I did. And I had the biopsy where they stick a needle through the rectum. It was MRI guided. There's another one where they don't. They stick it through the perineal or whatever, the area between your testicles and your anus. That one's supposed to be like less chance of getting an infection, but apparently they didn't do that in my place. So they went through the rectum with an MRI, it's MRI guided because they already knew there was a problem area. And they took like 15 samples of my prostate. Yeah, of course, they stabbed that problem area quite a bit. And all that, the procedure, you're sleeping, so you don't feel it at the time. And that all went well as far as, it was tolerable. I woke up, went home, everything was fine. But as that evening progressed and into the next day, I was not able to urinate. My enlarged prostate was swelling and squeezing on my urethra. So the next, towards the evening of the next day, I had to be rushed back to to an emergency room by my wife. And when I got there, they checked me in, got me back to a bed pretty fast because I was in agony. And I got on this bed, and they gave me some morphine, and I was swaying my legs back and forth. The morphine took a little bit of the edge off, but I was in agony. I was fairly lean at the time, and I was starting to look pregnant. I could not pee. That part was over with, and I was getting more and more bloated in the belly area. So I was there. It seemed like a couple hours, and they had put a heart monitor on me, a blood pressure monitor, and all that. And my blood pressure, which is normally pretty low, like 110/60, was 210/90. And that just shows you what type of pain I was in. And the reason I was there for a couple hours was this was after hours at the emergency room, and they were waiting for a catheter that they thought was the appropriate size, that was a smaller gauge tubing. And apparently whoever they were supposed to be getting that from never showed up, so they had to go with the catheter that they had at hand. And anyways, the nurse came in finally and said, "Are you ready?" And they slammed that tube right up my pee hole. While I was wide awake. I was in such agony. I thought I was going to, get all teary-eyed and screaming and crying from that tube going up my pee hole. But I did scream, but I never cried. And as soon as it got inserted, I felt instant relief as they were starting to drain the urine out of my body. The one nurse there said, it was a male nurse. He said he never seen that much urine in his career come out of another human being like that. It was like I was ready to explode. I knew the exact amount of cc's before, but it's been a while since I told this story, so I don't want to say anything wrong, but there was a lot of urine in there. A lot. So they drained me and drained me and drained me and drained me. And that was it. I got relief. I had a catheter in me. If you don't know what catheter is, some younger men don't. It's a tube that goes up your penis, and you into your bladder. Bubble holds that tube inside your bladder, and you urinate through that tube into a bag. And that's how I left the hospital, with a bag attached to me. I went home. It was not a very pleasurable experience having that tube up inside me. But it is what it is, right? I didn't have a choice. It was get that catheter, or probably, most likely I would be dead now. So about 4 days later, I decided, smart old Ken, that I'm going to take that catheter out myself. So I watched a YouTube video on how to remove the catheters, because I was feeling pretty normal, but man, that catheter was just irritating my pee hole. Something awful. Every time you move, that rubber tubing would slide in and out of your penis. And if you have like me, I would have nighttime erections while I sleep. So that tube was sliding all over the place. So it was just, I was getting very irritated down there. So I decided, it's been 4 days. I'm going to remove that catheter. So I did. I watched a video on how to do it. I went into the shower. I cut the one tube on the bag that will make the ball inside your bladder come down in size so you can pull that catheter gently out your pee hole. I did it while I was standing in the shower. It was not that painful. I probably should have went a little slower than I did, but that was the first time I ever did it. And got that catheter out of me. And, I almost regretted taking that catheter out so fast, because the next day, I think I took it out on Wednesday. On Thursday, I was starting to worry that I was going to have to go back to the ER because I was starting to have difficulties peeing again. But I fought through that Thursday, and things got somewhat back to normal. And on that Friday, I had to go see my urologist so I could get the results of the biopsy. So I went in, and they told me that the problem area that was on the right side of my prostate, that came up negative for any cancer. And they did all kinds of biopsies on the left side. Everything came up negative, but 2 samples that were not part of the problem area on my right side came up positive for cancer. A 4+3 Gleason score. One sample was in the left medial, which I think was that was 5% positive, and the other sample was in the left medial, which are or right medial. It was the right side, so everything's right. Don't forget me saying left on anything. But anyways, the problem area on my right side, they got samples out of that, all come up negative. The left side, all negative, but 2 areas on my right side came up positive with a Gleason score of 4+3. One sample, left medial, was 5%, and right medial was 5%, and the other sample, right perennial, so more closer to the outer shell, but not at the outer shell, was 20%. So 20% in one sample, 5% in the other sample. Everything's on the right side of the prostate. These problem areas didn't show in the MRI. I mean, the where they took the samples that came up positive, you couldn't see any problem there on the MRI. So that cancer in that area was invisible to the MRI. I still had that problem area, but all the samples out of the problem area were negative. All right. So just remember, everything's right side. 20% sample on the right side, 5% sample on the other side showed cancer. A Gleason score of 4+3. So a 3+4 would have been better, but I was a 4+3. The 4 meaning there was more aggressive cells on the 4. That's why you get a 4. And then the 3 is less aggressive. So overall, they look at a 4+3 as an intermediate risk, even though, keep in mind, it was invisible. You couldn't see it on an MRI. So that's what the diagnosis was. The urologist told me I had to get something done, in his eyes, within the next 6 months. And he was recommending surgery. He thought I would go through getting my prostate removed, that most likely I wouldn't be incontinent. They would try to preserve the nerve bundles that are on the right side and the left side of the prostate. Those nerve bundles control erections, and there's other nerves in there that also control being able to pee and hold your pee. So there's all kinds of things you don't want damaged, right? So anyways, uh, the next step is to go see all these specialists. And the thing about prostate cancer, and that I want to let everybody know, I know that if you were newly diagnosed, you're learning this. They don't tell you exactly what to do. They give you options. So I had to go see the surgeon that does the prostate removals, and he told me, gave me the spiel on getting my prostate removed and all that. Um, and then I had to go see a radiologist. And what they wanted to do was brachial radiation. But in the meantime, after I got this diagnosis from the urologist, I need to explain that the next day I had my first heart attack. So I had a heart attack, and I'll go into that story at some other point. I had a first heart attack, and that meant they put me on blood thinners. So that meant that the treatments for my prostate cancer had to be changed because I couldn't have surgery to have my prostate removed if was on blood thinners. And I couldn't have the brachial seed radiation if I was on blood thinners for prostate cancer. I mean, for a heart attack. So I couldn't have that. I couldn't have the brachial radiation. You got that because of blood thinners. So that eliminated the two things they were suggesting to me. Surgery couldn't be done. Brachial radiation could not be done because of the heart attack. The only thing I could have active treatment with at the time was I could have exterior beam radiation. That was the only option available to me. That would have been, I believe it was 8 weeks, 5 days a week, going in and getting all of the prostate irradiated. Of course, when you have the exterior beam radiation, the it also your rectum and your bladder and all that gets radiated along with it, especially with the type of exterior beam radiation they were going to give me. It was going to be full gland, and that was it. That was my only option, was exterior beam radiation. So I started doing research because I was thinking in my mind that my cancer is invisible. It's low volume. The problem area doesn't show no cancer. The left side of my prostate, no cancer. I started doing research, and I was looking at different, like the HIFU, which uses ultrasound, and they actually use high ultrasound to basically burn and ablate your prostate in the problem areas. They do that through the rectum. But I have a large prostate, so doing the regular HIFU through the rectum most likely wasn't going to work for me. So I stumbled upon a procedure called the TULSA-PRO procedure. And it's also like HIFU, they use ultrasound to ablate the problem area, to burn it out with ultrasound. Well, with the TULSA-PRO, instead of going through the rectum, for people that have enlarged prostates, they go through the urethra, which is, the tube that you pee out, right? And I decided that I wanted to have that procedure, but, I was on the blood thinners and all that. And I had to wait to get my cardiologist to say I could go off the blood thinners to have the procedure, because you got to be off those blood thinners for a week. And so I was diagnosed in the spring, and in October, I ended up having the TULSA-PRO procedure. I had it done in South Carolina by a doctor called Dr. Rich. what happened to me is, as I was doing my search for a place that I could get the TULSA-PRO done, some places were just out of pocket, and they were charging like $35,000 for it. And I didn't want to pay out of pocket. I'm on a Medicare Advantage plan. And I saw that the FDA approved it when I was looking around online. I'm discovering all this in myself. They approved the TULSA-PRO procedure in like 2019. And I saw that Medicare approved it also. So I stumbled upon a TULSA-PRO, like some type of organization that promotes the TULSA-PRO. And I called there, and the lady gave me phone numbers and addresses of places to start calling to see if I could get in to do the procedure there. The closest place to me was a Mayo Clinic, and in Jacksonville, Florida. So I called there first, and sure enough, they did accept Medicare for the TULSA-PRO, but I had Medicare Plus. And they don't accept Medicare Plus, so that I couldn't get it done there. So the second place that was on the list was this place in Myrtle Beach, South Carolina, which was about a 3-4 hour drive from my house. And I called up there, and I found out they were actually part in my regular insurance plan, my Medicare Advantage plan. They were in network in that area. So it was just luck on my case. And I went up there and I saw Dr. Rich, and he said that I saw him early on. He said, as soon as I can get you in is maybe towards the end of October. We decided to go with it. And but I still had to jump through hoops. You got to fight for yourself, because they, after a few visits going up there, they contacted me and said that my insurance didn't cover it. And I'm like, I was like, that just can't be right. And they said, well, we can talk to you about our procedure. Well, I could get other procedures like done right where I was at in my local area. My local area didn't have any type of HIFU or any type of ultrasound ablation. So they had the standard radiation and surgery. What I ended up doing was contacting my insurance company and asking if they had a code for ultrasound ablation, regardless of what they called it. And sure enough, they did. Ultrasound ablation of the prostate. They had a medical code for that. I said, well, that's it right there. So I had a very nice lady from my Medicare Advantage person on the phone, and I have that plan out from Michigan. And she agreed to do a 3-way with the person in Myrtle Beach. It's Highlands, is the medical center there, Highlands, to do a 3-way so we could talk about having coverage. And anyways, through that 3-way conversation, it was discovered that, in fact, it is covered, and Highlands would get reimbursed for the TULSA-PRO ultrasound ablation of the prostate. So anyways, it all got approved. I mean, it was a little rough waters, but I fought for it, and I got it approved. So finally, I got my cardiologist to approve to take me off the blood thinners a week ahead of the procedure. We had to decide if they were going to do a total ablation of the prostate or not, or just do the right side where the problem areas is. Dr. Rich from Highlands, South Carolina, Myrtle Beach, calling you out there. He decided, I put all my trust in him. He decided we were just going to ablate the right side of the prostate. Hopefully saving, not totally annihilating the nerve bundles on the right side, but I would have my left side nerve bundles untouched and the the prostate on the left side, some of that would still be there. So that's what we decided to do. He ablated the right side, and you go home, you have a catheter once again. So I have a catheter for 10 days. And after 10 days, the catheter wasn't the most enjoyable. And I had the catheter removed. And sure enough, no joke, it wasn't fun again after the removal because I got a UTI, a urinary tract infection. The first time I've ever had that in my whole life. And I guess that's somewhat common. So I was starting to not being able to pee again. And after a couple trips to the local ER, mind you, they're doing ultrasounds and x-rays of this ablated prostate that, I just had this procedure done, and the local people don't even know anything about the TULSA-PRO. The ER doctor, this young cat, he recommended that I go back up to the person that did the procedure, which was a 4-hour drive away from my house, and have him, because he had experience with the actual TULSA-PRO, he knows what he's looking at, have him, maybe drain my prostate, do what he has to do. So anyways, I called up Dr. Rich. He contacted me at home, talking to the doctor, not the nurse. And he's had me come up there and see him. And he gave me options to do. But I said, doctor, what would you do if this was you? So after that first initial consultation with him, he got me back in there 2 days later, and he drained my prostate under anesthesia. He drained it, but it filled right back up. So this is, it was becoming a real problem because it didn't look like it was going to heal. So he reinserted the catheter. Mind you, after the TULSA-PRO, I already had the catheter for 10 days. He reinserted the catheter, and I think I was going to end up having it for 15 more days. And if that didn't work, he was going to have to go through my lower abdomen, put a tube directly into my bladder and basically disconnect that area down there and let it heal. He was reassuring me that I wouldn't end up being incontinent, that he would fix me. He was reassuring me that. But, when you're going through this, it's, you're so unsure. And anyways, at 15 days, I went back up and seen him. And, he could have removed the catheter right then. But I said to him, is there any chance that, if I keep it in for another few days, that it might up my chances of, because I didn't want to have the tube stuck directly into the bladder through my lower abdomen. So he said, yeah, and it might, there might be benefit for keeping the catheter in longer. So I kept the catheter in another 5 days and just removed it myself at home. Getting pretty good at removing those catheters. I just, once again in the shower, clipped it. And this time I pulled it out real slow, and it wasn't bad. And I got it out, and sure enough, that was it. I was finally done with the UTIs. I was able to pee, and everything started turning up okay. But for weeks on end after that, every time I sneezed, I would, a squirt of urine would come out in my drawers. So I had to have like a pad down there. I mean, I guess it's manageable if you like to wear pads and diapers as a man, but, I wasn't too hip on that either. So I went through all that, and I got eventually I stopped wetting my britches when I sneezed or anything else. All that came back to normal. And the main side effects I had after that was erectile dysfunction because, they didn't come near the left nerve bundle, but they came close to the right nerve bundle, and they definitely damaged that area because I had fairly good erections before the procedure. And when they put you on like Cialis or Tadalafil or Viagra or whatever. But when you have nerve damage, those they don't work. And that the Tadalafil or the Viagra mainly is just so you can maintain blood flow in your penis area to keep that organ from keep it as healthy as possible. Why hopefully your nerves come back and start allowing you to have get back to baseline at least. So they're still used for the Viagra and the Cialis and everything, but it's not don't for me it didn't cause erections. It was just for blood flow because as a man you will have nighttime erections even if you're not sexually stimulated. That's just your body getting the blood in there and letting it rush out. It's just a healthy function. Well, when your nerves are damaged, that isn't happening. So they give you the medication to hopefully keep your penis basically somewhat healthy, right? So anyways, because I had the UTI and all that, me coming back and recovering up to baseline, me and my erections would be the same as they were prior to the procedure. It just is taking me longer. And even today, this is the beginning, we're almost at the beginning of August. This is the end of July. So I'm a ways out from the procedure, maybe 7-8 months out, and I am starting to those nerves are starting to slowly wake up. It gets pretty depressing. You think you're never going to come back to that performance that you want as a man, but I am starting to get nighttime erections. Not every night, but some nights several and some nights none. So to me, it seems like I'm progressing, and that those nerves on that right side that were traumatized are slowly coming back. But one thing that isn't coming back is you gotta get used to it. And I mean, I guess it's no big deal, but after the TULSA-PRO or having your prostate removed, this is another thing. You won't have dry ejaculations after that, but you can still have orgasms. I mean, that's something that can still happen. So you have the pleasure, you just don't have the mess. If you know what I mean. There's no more, put it this way: your wife won't be using it for facial cream anymore. Not that I did that sort of stuff, but that's just me being dirty. I never did that to my wife or anybody that I was ever involved with. But anyways, so you have dry orgasms. You can deal with that. My PSA after the procedure started to drop. I had another MRI. The procedure I had was in October of 2025. I had MRI the following January. It shows high unlikelihood of any malignant cancer. Nothing is showing in my prostate no more. My last PSA was the first one after the procedure was 2.1. The one after that, I got it all the way down to 0.91, so less than 1 now. It's going down. And here in August of 2026, I'm having another PSA in a couple of weeks. And so all that's good. PSA is going down. Nighttime erections are starting to come back up. You know, hopefully down the road, I will be back to baseline where, having normal male capabilities again. It's just a slow process. I'm not, I know the men out there that have prostate cancer have a lot of questions. If the erections don't come back, there's always something they can do for the erections. They can, if the pills, they're not going to work if the nerves are damaged. The Trimex, which is actually a needle you stick in your penis and put the shot in there, that will cause the erection because it doesn't depend upon the nerves to give you erection. The Trimex actually circumvents that, and you get an erection anyways. But I'm just not too hip on that because I know it over time it can damage your penis, and you can get Peyronie's disease, and it just leads to further damage. I can't see sticking a needle in your penis for the rest of your life. And then if it really doesn't come back, if you're, you can use the vacuum devices, you can use penis rings. There's all kinds of things you can do. But, the one thing that most men are very satisfied with, like over 90% of men and their partners are satisfied with penile implants at the end of it. If that's like in game, I wouldn't rush to get that done. But, if it came to it, that is something you could consider. You will still have normal orgasms with them. I would, if I had done, I'd prefer to have the one that's inserted inside you. And, you pump it up and you have your sex and you can stay erected as long as you want. And when you wear your wife or girlfriend out, or for some, maybe their boyfriend, I guess. But whatever the case may be, who am I to judge? And then you just deflate it and you go about your business. That has over like a 95% satisfaction rate for both the person that has the penile implant and their partners are very satisfied with that. Sounds like a win. I saw a guy on YouTube. He was like, men with penile implants have an unfair advantage because they can go as long as their partners want to go, and satisfaction almost guaranteed. But in fact, I heard that some of the men actually have multiple orgasms, which is not normal for a man. So, something to be considered, and it's not something to be embarrassed about. If you had prostate cancer like me, if it comes to that, that's what I would do. But right now, slowly, things seem to be waking up down there. And I'm just hoping that I will continue in that process. They say it can take 18 months to 2 years to get back to baseline, especially if you had, complications like the UTI I had. Altogether in 2025, I had a catheter inside me for over 30 days, right around 30 days. And, I had to remove it 3 different times. It wasn't a pleasant experience. So this is my experience. I got to say, guys, that for you that have prostate cancer and diagnosed, I understand it all sucks because nothing you do guarantees anything. If you have your prostate removed, numerous guys have their prostate removed if they think they got the cancer out, only to have the cancer come back in the prostate bed, and then they have to have salvage radiation. My MRI isn't showing any cancer, but could it come back? Certainly could, because I have a third of my prostate left in me. In fact, technically, I still have BPH. I'm at a 35. Anything over a 25 is considered BPH. But I was like 150 before that shows you how much they ablated me out. So 150 cms, I think they use cms all the way down to now I'm a 35. So I still have quite a bit of prostate left on my left hand side, but I'm able to urinate, hold my urine pretty good at night. Sometimes I'll sleep all the way through the night now. So all that has been a big improvement. I'm not satisfied with the erections yet, and I'm hopeful the cancer will never come back. But if it does, we'll have to go from there. The problem with prostate cancer is if you don't have nothing done 15 years out, you'll probably still be alive. If you have something done 15 years from that day, you probably still be alive. So whether you get something done or you don't, 15-year mortality rate is the same. But after that 15 years is when things start changing. Normally, prostate cancer, the first place it spreads is to the bone. And once it escapes your prostate, it is not curable. It's just manageable. And if it gets to that point, that's when the treatments really suck. Because what do they want to do to you? They want to castrate you, which means they want to take all your testosterone from you. You actually go into like a male menopause, just like a female menopause with hot flashes and everything. You'll be fatigued. If you enjoy working out, your capabilities will go way down. You could possibly end up castrated and incontinent from prostate cancer if it gets that bad. So, you know, whatever you choose to do, it's your choice. There's no guarantees. I chose to get a treatment, the ultrasound ablation called TULSA-PRO, and you know, I'm out from it. I'm not incontinent. I can hold my pee. I sleep all night. The erections aren't all the way back yet, but they're coming back. I'm having nighttime erections again, so that's all getting better. But don't be embarrassed. You got to make the decision. Understand there is other options. Don't let the doctors just push for prostate removal and exterior beam radiation, things like that, brachial seed radiation. There is other options. There's big studies out there with the TULSA-PRO versus having your prostate removed. None of it has guarantees. Uh, Having the TULSA-PRO procedure, supposedly, I would be able to have surgery if it came to that. But, I'm not too hip on having my prostate removed because I already seen the side effects just from having half my prostate ablated. And, it's not fun. And I'm afraid if they removed the whole prostate, I would end up being incontinent. Who wants to be a man that is castrated and wearing diapers for the rest of your life? Do you really want to go out like that? Most people that have prostate cancers die from heart attacks. And I already had one heart attack. Could have been related to the stress and the biopsy that caused my blood pressure to go up to 210 over 90 for hours at the end, and it loosened up some old existing plaque in the arteries. That's what I think happened because I had my first heart attack a week after that first biopsy, my first and only biopsy. So, all right, man. I know I rambled on. There's so many different things about prostate cancer. If it's isolated to your prostate, you can choose a procedure other than radiation and surgery. You could do the TULSA-PRO is FDA approved, and there is places if you're on Medicare, Advantage plans and regular Medicare that will actually pay for it. And maybe if you're younger than 65, your own healthcare plan will pay for it. So I'm not saying the TULSA-PRO is the greatest thing in the world. I'm hoping artificial intelligence will come out with better and better treatment options for men. My end goal is not to be incontinent and castrated, and that's it. Maybe, hopefully, you won't be have that happen to you either. If it's you get that cancer before it gets out of the prostate, before it metastasizes, you can actually you can be cured. You know, there's a chance. No guarantees though. Once out of the prostate, chemotherapy, castration, that's it. And they give you our meds to try to control it. There ain't a whole lot they can do. So, all right. If you have any questions for me, feel free to, send me questions. Like and subscribe. I'll give you shorter videos. I know, man, you got to be brave when it comes to prostate cancer. It all sucks. That's it. Keeping up with Ken. Out.